Oh, very difficult. Because I don't know my school. So you didn't see. Do you want to repeat it?
Professor, can you close one window, please, because we hear you in double.
But okay.
Yeah, good.
It's okay now?
Yeah, good. Perfect.
Okay. Do you want to repeat this or proceed? Okay. The bones that you have already here. Heard. And after that we have where is the location of the orbit with the bones, the bones and the sinuses. Again, the bones and the fissures and the foramens. And here are the another structures, not only the eyeball and the muscles and the adipose tissue and nerves and vessels. The sinuses that are near the orbit and the foramina and from which foramen, which part of the nerves goes through. And we start with the innervation. We have motor innervation and sensory innervation. The motor innervation is by nervus oculomotorius, trochlearis, abducens, and facialis. The sensory innervation is from the nervus trigeminus with its branches, nervus lacrimalis, frontalis, nasociliaris, intraorbitalis, and zygomaticus. They are part of the second branch of the nervus maxillaris. We have sympathetic and parasympathetic innervation. The sympathetic innervation starts from central cerebrospinale through ganglion cervicalis superior, through plexus caroticus internus, ramus sympathicus at ganglion ciliare, nervus ciliaris brevis and longis. And this is the innervation of muscle, the tatropupille, the muscle of Muller, the orbicularis muscle, and the uveal blood vessels walls. The parasympathetic innervation starts from ganglion pterygopalutinum through nervus facialis, nervus zygomaticus, and lacrimalis. Nervus oculomotorius with radix oculomotoria, ganglion ciliare, and innervates muscle sphincter pupillae and muscle ciliaris. And when you do anesthesia, parabulbar or retrobulbar anesthesia, our aim is to innervate this ganglion, the ciliary ganglion. The vascularization is from arteria ophthalmica, which is branch of arteria carotis interna, and its branches are arteria lacrimaris, which supplies the glandula lacrimaris and the anterior, the lateral part of the eyelids and the posterior lateral part of the conjunctiva. Arteria muscularis, they supply the anterior ciliary part, the ciliary body and iris, and the anterior conjunctival part. Arteria centralis retina, that supplies the retina, and arteria supraorbitalis supplies the upper part of the orbit. Arteria ciliaris posterior brevis and longi supplies the uveal part of the eye, and the arteria ethmoidalis posterior and anterior supplies the medial part of the orbit. Arteria palpebralis medialis, they supply the medial part of the eyelids and the medial posterior conjunctival part. And arteria supratrochlearis and arteria dorsalis nasi are terminal part. They do not have junction with other arteries. They are terminal arteries. And here is here are the 6 muscles that are responsible for the eye movement: 4 rectus muscles and 2 oblique muscles. Again, the muscles here, they connect. Five of them here connect and form the annulus of Zinn. Only the inferior oblique muscle is not from this part, from the annulus of Zinn. The important is that the vascularization of choroid is from the arteria ciliaris posterior brevis, and the vascularization of the iris and the ciliary body is from the long ciliary posterior and the ciliary anterior arteries. The orbital veins have no valves, infections, or eyelids, and facial skin and the infection of eyelids, facial skin, and nose may cause thrombosis of the cavernous sinus. You know that it is life-threatening condition. The eyelids are another part of the adnexa of the eyeball. They have several layers: skin layer, muscles, tarsal plate, and conjunctiva. Here is the skin of the eyelids. Below is the muscle. This part is the orbiculary muscle. After that is the tarsal plate and the conjunctiva. Here we have the gray line where the skin met the conjunctiva, and here we have the eyelashes. Here we have the levator muscle. It is responsible for the movement of eyelid up and down. The orbicularis muscle is responsible for the closure of eyelids and for squeezing. Another section with the conjunctival part, the tarsal plate, the orbicularis muscle, and the skin. One more. And here, the muscle fibers of the orbicularis muscle go in this direction. And here we have the levator muscle with the aponeurosis. The levator muscles connects with the tarsal plate. Some of branches go to the skin, and some of them go to the conjunctiva. Another part of the nexa are conjunctiva. We have bulbar conjunctiva that covers the eyeball. Fornix, it is in this part inside, but in this part of the eye. And tarsal, we have already seen the tarsal, but this is the tarsal part that covers the eyelid from inside. The eye muscles, we have 4 rectus muscles, superior, medial, inferior, and lateral. 3 of them have innervation by oculomotor nerve, and the lateral is innervated by the abducens nerve. And we have 2 oblique muscles, the superior, with the trochlear nerve innervation, and inferior with oculomotor innervation. Here is the annulus of Sinn that I have already told you, and this is the direction of the muscles, and here they are attached to the bulbus. And here we can see the oblique muscles. The attachment of the muscles is in different distance. Closer are the medial muscle, and here the distance is, here is the bigger distance. And this forms the spiral of Thiebaud. Again, 4 rectus muscles and 2 oblique muscles. They are responsible for the eye movement medially, laterally, up, down, and rotation of the eyeball. Important is that the insertion of the rectus muscle are in the front of the equator of the eyeball, and those of the oblique muscles is behind the equator. The lacrimal system, it consists of tear production structures and tear drainage structures. The tear production is mainly from the lacrimal gland, but we have in the conjunctiva, we have additional accessory tear gland production. And the drainage systems consist of 2 lacrimal punctum, 2 canaliculus, saccus lacrimaris, and ductus lacrimaris. Again, punctal, the canaliculus, and ductus. Ductus lacrimalis is opened below the inferior concha in the nose. What is the function of the tear film? It improves the optic quality of cornea by polishing its surface, moisturizing the corneal and conjunctival epithelial, wash and disinfect using tear flow and bactericide properly. It consists of lysozyme. And the 4th, nutrition of the corneal epithelium. The additional lacrimal glands produce the three layers of the aqueous humor, of the lacrimal humor. This is the mucin layer. It is produced by Henle glands. They are situated in the tarsal plate, Mans glands that are situated perilimbo, and the buccal cells. The water layer is produced by Krauss glands in the upper fornix, Wolfram glands upper and in the upper end of tarsal plate, and the lipid layer that is produced by the meibomian glands that are inside the tarsal plate, the Zeiss glands that are near the hair follicles, and Moll glands that are modified sweet glands near the hair follicles. This is important that the secretion, retaining, and inflammation of the glands of meibomi and Zeiss lead to the development of hordelum internum and externum. And the most important part is the eyeball. It has three shells or membranes. The first one is cornea that goes to the sclera. The second part is the uvea, that this part is the choroid, and after that here is the ciliary body and the iris. And the inner part is the retina. Inside the eye is not empty. It has the anterior chamber, posterior chamber, the lens, and the vitreous body. Again, the anterior chamber, the posterior chamber, lens, the vitreous body. Here is the cornea, the sclera. After that is the choroid, the uvea, the choroid. After that, it passes to the ciliary body and the iris and the retina, the neuron part of the eye. If you have any questions, you can interrupt me and ask. Cornea. It is transparent, without vessels, and with a lot of neurons that do not have myelinization. It consists of 5 layers: the epithelium, the Malman layer, the stroma, the descemet membrane, and endothelium. The epithelium consists of 4 or 5 layers with cells with microvilles. And important is that we have, when any damage here, the regeneration is complete without any defect, but it is very painful. 90% of the cornea is the stroma. It consists of keratocytes and collagen and elastin fibers that forms the structure of this collagen is very strong, and we have some glycoproteins here. The endothelium has an ectodermal origin. It is from one cell's layer, and it is not regenerate. Here we have an active transport, and due to its transport, the stroma is in a condition of dehydration. That's why it is transparent. If more water comes in the stroma, it will become white and it will be not transparent. The same is when vessels from the conjunctiva go in the cornea in some disease. So it is avascular, the cornea, and the nutrition is from the epithelial, from the aqueous humor, from the inside, from the aqueous humor of the anterior chamber, in the anterior chamber, from the tears, and from the vessels that are in the junction of conjunctiva and cornea. This space, the name of this space is limbus. And these are the cells of the epithelium of the cornea with microvilles. And this is the configuration of the endothelium with one layer of hexagonal cells. Important is that the transparency of cornea is due to absence of blood vessels, no myelin around the nerves, dehydration supported by endothelium, and arrangement of the collagen lamellas. That's all. The sclera. The sclera is white, fibrous, composed of collagen, and is actually continuous with the clear cornea anteriorly. It consists of episclera, substantia propria sclera or stroma, and lamina fusca sclera. Again, cornea, and after that is the sclera. The thinnest part of the sclera is here, where the nerve fibers cross the sclera and form the optic disc and the optic nerve. The anterior chamber angle is very important. Why? Because here the processes of iris produced the aqueous humor of the eye. After that, it goes through the posterior chamber, through the pupil, and inside the anterior chamber. But it should go out of the eyeball, and it is from the anterior chamber angle. It forms from the iris and the cornea. Here is situated the trabeculum, and the water goes through the trabeculum in the Schwann canal, and after that the collector veins and the episcleral space. It is very important because the glaucoma is one of the leading parts of blindness in the world. Again, the trabeculum, the canal, and episcleral vein. The uvea is the second membrane of the eyeball. It consists of the iris, the ciliary body, and choroid. The iris, the ciliary body, and choroid. The iris is very important because it allows is responsible for the for that, how many light will go into the eye because of the constriction of the pupil. It is important. The ciliary body is important because it produces the aqueous humor first, and second, it participates in the accommodation. Due to the accommodation, we can see clear in the near. When here the ciliary body has muscles that, when they are constricted, they lead to looseness of these zonules, and it leads to the lens to become thicker. And because of this, we can see clearly in the near distance. The choroid consists, this membrane is called vascular membrane. The first one, cornea and sclera, is the fibrotic membrane. This is the vascular membrane. The choroid consists, let's see. The choroid consists of large, smaller, and very small vessels, choriocapillaries, and it consists of cells that have melanin, and this is the reason why we have a black camera inside the eye. The sympathetic stimulation of the pupil leads to the pupil dilation, mydriasis, and the parasympathetic stimulation leads to the constriction of the pupil, meiosis. The ciliary body has two functions. We have already mentioned it. It secretes aqueous humor and it controls the shape of the lens. The ciliary body contains muscles that change the lens shape by relaxing the zonular fibers attached to the lens capsule. And here we have the sclera, the large vessels, smaller vessels, and the smallest vessels of the choriocapillaries, and the Bruch membrane, which is attached to the retinal pigment epithelium layer of the retina. And this is important to know that the high permeability of the choriocapillaries is determined by the great lumen and fenestration of capillaries that leads to slow blood flow, maximum utilization of oxygen and nutrition substances, and precipitation of toxoallergic agents, unfortunately. So inside the eyeball, we have the anterior chamber again, the posterior chamber, the lens, and the vitreous body. The lens consists of capsule, anterior capsule, posterior capsule, cortex, and nucleus. With the aging, the nucleus becomes larger and harder. The vitreous body, it is a jelly structure that consists of cells, hyalurocytes, and elastin and collagen fibers, and a lot of hyaluronic acid. It is attached strongly here to the lens, and here in the pars seca and ora serrata of the retina, and around the optic nerve. With the age, start some degenerative processes, and the jelly is not a real jelly. It starts to have some empty spaces and more water and more fibers. And it leads to the detachment of the vitreous body, which is not a disease. This is a sign of aging. But in some individuals, when they have some problems in the peripheral retina, the detachment of the vitreous body can cause detachment of the rupture of the retina and detachment of the retina, which is a serious complication. And the retina. The retina is the most important part of the eye. This is the neuron system of the eye. What do we have? We have the optic disc. This is the fundus. With the optic disc and the vessels, they are branches of arteria centralis retinae and the macula. The retina is the inner layer of the globe. It consists of two parts, a photoreceptive part, pars optica retinae, comprising the first 9 of the 10 layers, and a non-receptive part, pars seca retinae, forming the epithelium of the ciliary body and iris. The pars optica retinae merges with the pars seca retinae at the ora serrata. The layers of the retina. We have 10 layers of the retina. Here is the sclera, the choroid, and here is the first layer of the retina, the retinal pigment epithelium layer. After that is the first neuron, cones and rods. Photoreceptors. They are photoreceptors. The first photoreceptor layers, cones and rods. The photoreceptors layers are closer, are in junction with the choriocapillaries of the and Bruch membrane of the choroid. And when something happens, and it leads to detachment of the retina is detached in this part between the retinal pigment epithelium and the photoreceptors. The photoreceptors have an important role because in them the light is turned to a new impulse. They have rhodopsin here that is responsible for this transformation of the light to the nerve impulse that goes from the first to the second and to the third neuron of the retina. We have 3 neurons in the retina, the photoreceptors, the bipolar cells, and the ganglion cells. And the axons of the ganglion cells form the optic nerve. These are the photoreceptors. The bipolar cells, and the ganglion cells. In OCT, you can see every layer of the retina. This is optical coherent tomography, one of the new image examinations that we have. These are the cells of the pigment, retinal pigment epithelium, and they are in connection with the photoreceptors, the cones and rods. Macular lutea. The macula lutea is a flattened oval area in the center of the retina, approximately 3-4 millimeters, 50 degrees temporal to and slightly below the optic disc. Its diameter is equal to that of the optic disc. The macula appears yellow when examined under green light. Hence the name macula lutea, or yellow spot. Located in its center is the avascular zone fovea. So, the optic disc, the vessels, and the macula. In the center of the macula is the fovea. In the fovea, we have only cones. They are responsible for our good vision. In the periphery, we have cone and rods, and in this part we have only rods. They are responsible for the cones are responsible for our visual acuity and for the color vision. And the rods are responsible for the movement in the space and for the black and white vision. Here, where is the fovea, we have only photoreceptors. We don't have the inner layers of the macula, of the retina. Again, OCT, optical coherent tomography, when we can see all the layers of the retina. The vascular supply of the retina is the inner layers of the retina from the inner limiting membrane through the inner nuclear layer are supplied by the central artery of the retina. This originates from the ophthalmic artery, enters the eye with the optic nerve and branches of the inner surface of the retina. The central artery is a genuine artery with a diameter of 0.1 millimeter. It is a terminal artery without anastomosis and divides into 4 main branches. Because the central artery is a terminal artery, occlusion will lead to the retinal infarction. The outer layers from the outer plexiform layer through the pigment epithelium contain no capillaries. They are nourished by diffusion primarily from the rich supplied capillary layers of the choroid. The retinal arteries are normally bright red, have bright red reflex strips that become paler with advancing of age and do not show a pulse. The retinal veins are dark red with a narrow reflex strip and may show spontaneous pulsation on the optic disc. So, the pulsation in the retinal vein is normal, but the pulsation in the retinal artery is abnormal. And this is the transformation of the light in the neuron impulse from the photoreceptor layers of the retina. So the axons of the ganglion cells form the optic nerve. This is the disc of the optic nerves that we can see when we do ophthalmoscopy, and after that they go outside the eyeball, and they form the orbital part of the optic disc. After that is the intracanalicular part of the optic nerve, and after that is the intracranial part of the optic system. We have 3 neurons in the retina. After that, we have the 4th neuron here in corpus geniculum laterale. And what other is important, that the medial part of the fibers from the medial part of the retina cross and go to the contralateral hemisphere, and the lateral part of the retina do not cross and goes to the hemilateral part of the hemisphere. After they go to the corpus geniculum laterale, from here starts the 4th neuron that goes to optical radiation to the occipital part of the brain. Again, the same picture. And that's all. I don't know if you have to know something about the embryology. If you want to tell you something, give me a sign. Okay. In the second gestation week, at the anterior starts the formation of the eye structures. At the anterior end of the neural tube, from 2 visual spots, visual furrows are formed, which pass into lobes, which later inflate outward and form a vesicula optici, which are associated with the prosencephalon via pedicus opticus. As they grow, these vesicles push the mesenchyme toward the ectoderm, where thickening occurs. This is the lens plate. When we have a 5 millimeter embryo, this vesicle begins to be invaginated from the lens plate. An eye cap is formed. The lower part of the eye vesicle also deepens. A cleft is formed, which continues in the pedicus opticus. This is the fetal cleft. Through it enters the mesenchyme, which forms the chyloid system. The fetal cleft later closes completely. If it is not happens, colobomas can occur. The lens plate becomes a lens cap when the eye is invaginated, and later it becomes a lens vesicle. Once the fetal cleft is closed, differentiation of the individual eye structures begins. For the retina, the 9 layers of the retina are differentiated from the inner layer of the eye cap. The final differentiation of the macula is completed approximately 6 months after birth. In the third lunar month, the edges of the eye cup grow forward and join in front of the lens to form the iris. The formation of the vitreous body, first we have primary, after that secondary vitreous body. They are vascularized by the hyaloid vessels, and the tertiary vitreous body are avascular. Rudiments of the eyelids appear in the 6th gestation week, grow and meet and coalesce in front of the eye at the 8th gestation week, and after the 5th lunar month they are separated. And this is the formation of the eye system from one cell to the end. I think that this is enough. If you have any question, I'll be happy to answer. When we start with the disease, you will know what is hordeolum internal and external. This is inflammation of these glands that I mentioned. Inflammation of the layers of the eyelid. But we will talk about this when we have disorders of the eyelids. This is my phone number. If you have any questions or you can be in touch with me, you can call me. If you have any other questions. I'll be happy if I have any feedback from you. Do you like the lecture? What other do you want to know? Because